Hey there, WellNexus family! Welcome back to the channel where we empower you to take control of your health and live your best life. Did you know that heart disease remains the #1 killer in America, claiming one life every 33 seconds? But here's the shocking part. Nearly half of all heart problems show warning signs that most people completely miss or dismiss as nothing serious. If you've ever felt something wasn't quite right with your body, but couldn't put your finger on it, this video is specifically for you. By the end of our time together, you'll know exactly which subtle signals your body might be sending to warn you about potential heart issues, and more importantly, what you can do about them starting today. Your heart is arguably the hardest working organ in your body, beating approximately 100,000 times every single day without a break. But despite its incredible resilience, our modern lifestyle puts tremendous strain on this vital organ. The American Heart Association reports that about 48% of American adults have some form of cardiovascular disease. That's nearly half the adult population. What's even more concerning is that many heart conditions develop silently for years before causing noticeable symptoms, which is why heart disease is often called the silent killer. The good news? Your body is incredibly intelligent and often tries to warn you through subtle signals that something might be wrong with your cardiovascular system. These warning signs do not always manifest as the classic clutching your chest in pain scenario we see in movies. Instead, they can appear in unexpected ways that most people don't associate with heart health. Let's explore the 5 most commonly overlooked signs that your heart may need attention. Sign number 1, unusual fatigue and exhaustion. If you're experiencing fatigue that seems disproportionate to your activity level, like feeling completely drained after climbing a single flight of stairs or needing to rest after simple household chores, your heart might be struggling to pump enough oxygen-rich blood throughout your body. This type of exhaustion differs from normal tiredness. It feels overwhelming and doesn't improve with rest alone. Research published in the Journal of the American Medical Association shows that unusual fatigue is one of the most common symptoms reported by heart attack survivors in the weeks or months before their cardiac event. Sign number 2, shortness of breath. During everyday activities, your lungs and heart work as a team. When your heart can't efficiently pump blood, fluid can back up into your lungs, making it harder to breathe. If you notice yourself getting winded during activities that never bothered you before, like walking to the mailbox, carrying groceries, or even talking on the phone, it might be your heart sending an SOS signal. According to the Mayo Clinic, this symptom often gets misattributed to aging, being out of shape, or anxiety, causing people to ignore a potentially serious warning sign. Sign number 3, persistent swelling in your lower extremities. Have you noticed your shoes feeling tighter at the end of the day? Or maybe indentations from your socks remaining in your skin longer than usual? This condition, called edema, can occur when your heart isn't pumping effectively, causing fluid to collect in your tissues, particularly in your ankles, feet, and legs. While occasional swelling can happen for many reasons, persistent or worsening swelling should never be ignored. A study from the American College of Cardiology found that peripheral edema was present in over 70% of patients eventually diagnosed with heart failure. Sign number 4, irregular heart rhythms or palpitations. Everyone experiences the occasional heart flutter or skipped beat, especially during moments of stress or after consuming caffeine. However, frequent palpitations, persistent racing heartbeat, or rhythms that feel truly abnormal could indicate an arrhythmia. A problem with your heart is electrical system. Atrial fibrillation, the most common type of serious arrhythmia, affects about 2.7 million Americans and significantly increases stroke risk. If your heart regularly feels like it's doing gymnastics in your chest, it's definitely time to get checked out. Sign number 5, sleep problems, especially sleep apnea. This connection surprises many people, but your sleep quality and heart health are intimately linked. Sleep apnea, a condition where breathing repeatedly stops and starts during sleep, puts tremendous strain on your cardiovascular system. Each time breathing pauses, oxygen levels drop, triggering stress hormones that raise blood pressure and heart rate. If you experience loud snoring, gasping for air during sleep, morning headaches, or persistent daytime sleepiness despite getting enough hours of sleep, you might have sleep apnea. Research shows that untreated sleep apnea increases the risk of heart failure by 140% and coronary heart disease by 30%. These 5 signs don't guarantee you have heart disease, but they deserve attention, especially if you have risk factors like high blood pressure, high cholesterol, diabetes, family history of heart disease, or if you smoke. Now that you understand these warning signs, let's talk about what you can do to protect your heart health. Step 1. Schedule a comprehensive heart checkup. If you've noticed any of these warning signs, start by making an appointment with your healthcare provider. A basic heart health screening should include blood pressure measurement, cholesterol panel, both LDL and HDL, blood glucose test, discussion of your symptoms and family history, possibly an EKG or other heart-specific tests based on your symptoms. Don't wait for symptoms to become severe before seeking medical attention. Early intervention can literally be life-saving when it comes to heart disease. Step 2. Adopt the Mediterranean diet pattern. Numerous studies show that the Mediterranean diet can reduce heart disease risk by up to 30%. This eating pattern includes abundant fruits, vegetables, and whole grains, healthy fats like olive oil, avocados, and nuts, lean proteins, especially fish rich in omega-3s, limited red meat and processed foods, moderate red wine consumption, if appropriate for you. The American Heart Association specifically recommends this dietary approach because it reduces inflammation, improves cholesterol levels, and helps maintain healthy blood pressure. Step 3. Implement strategic movement. Throughout your day, you don't need intense workouts to benefit your heart. Research from the Cleveland Clinic shows that just 30 minutes of moderate activity 5 days a week can reduce heart disease risk by up to 40%. Try brisk walking after meals, taking stairs instead of elevators, parking farther from store entrances, breaking up sitting time with 2-minute movement breaks every hour. Remember, consistency matters more than intensity when it comes to heart health. Step 4. Prioritize quality sleep. Given the connection between sleep disorders and heart problems, improving your sleep hygiene is crucial. Maintain a consistent sleep schedule, even on weekends. Create a cool, dark, quiet sleeping environment. Limit screen time 1 to 2 hours before bed. If you snore heavily or have symptoms of sleep apnea, talk to your doctor about a sleep study. Step 5. Manage stress. Effectively, chronic stress damages your heart by releasing hormones that increase inflammation and blood pressure. Effective stress management techniques include daily mindfulness meditation, even just 5 to 10 minutes, deep breathing exercises, regular time in nature, limiting news and social media consumption, cultivating supportive relationships. Harvard research shows just 15 minutes of meditation daily can lower blood pressure and reduce heart attack risk over time. Your heart works tirelessly to keep you alive, but it needs your help to stay healthy. The warning signs we've discussed today, unusual fatigue, shortness of breath, swelling in extremities, irregular heartbeats, and sleep problems, are your body's way of communicating that something might be wrong. Remember, heart disease doesn't develop overnight. It's the result of daily habits compounded over time, which means small positive changes can add up to significant protection for your heart health. By implementing the 5 steps we've discussed, getting appropriate medical screening, following a Mediterranean eating pattern, moving regularly throughout your day, prioritizing sleep quality, and managing stress effectively, you can dramatically reduce your risk of heart problems. The American Heart Association reports that up to 80% of premature heart disease and stroke can be prevented through lifestyle changes like these. That's incredible news. It means your daily choices truly matter. Don't wait for a cardiac event to start taking care of your heart. Listen to these subtle warning signs, take action now, and your future self will thank you with years of quality life and vibrant health. Now, I'd love to hear from you. Have you experienced any of these warning signs, or do you have questions about protecting your heart health? Drop them in the comments below. Our channel is dedicated to bringing you science-backed information to help you live a healthier, more energetic, and balanced life. We provide practical solutions to improve your diet, body, and mind, all in an easy and accessible way. Ready to take the next step toward a healthier life? Check out the recommended products that can support your journey. Find the links in the pinned comment. Subscribe now and turn on notifications to stay updated with the best tips on longevity, nutrition, and wellness. Let's transform our health together. If you found this information valuable, please give this video a thumbs up, share it with someone you care about, and subscribe to WellNexus for more evidence-based health content every week. Don't forget to hit that notification bell so you never miss our latest uploads. Until next time, here at WellNexus channel, we remind you that small steps today create a healthier tomorrow. Take care of that beautiful heart of yours.